let us learn about coma. Coma is a state of unarousable unresponsiveness in which the patient does not respond to any external stimuli. And there are different causes of coma. The main cause are the insult to the brain. Like the insult to the brain may be caused due to CNS cause like cerebrovascular accident, like cerebral infraction, cerebral hemorrhage, due to CNS infection like meningitis, encephalitis, in all the intracranial space occupying lesion. The other cause may be metabolic cause like diabetic ketoacidosis, uremia, hepatic coma, hypoglycemia. In other cause may be head injury, and other cause may be electrolyte imbalance, hyponatremia, and other cause may be epilepsy, overdose of drug, cerebral malaria, hypoxic ischemic encephalopathy, and psychiatric condition. All these conditions ultimately lead to defect in the brain. Like we have cortex, we have reticular formation, we have hypothalamus, and we have spinal cord or midbrain. Like if there is any defect in this pathway or any lesion which disrupt this pathway, then this leads to coma. Like coma, the features of coma is patient is unconscious, like there is neurological deficit, and there is labored breathing. How can we approach to the patient with coma? Like we should first confirm the diagnosis. For confirming the diagnosis, there should be after confirming the diagnosis, there should be rapid assessment and stabilization. Like we should protect the airway, secure breathing. We should maintain circulatory status and IV access. We should also control the temperature, maintain blood sugar, and after that, after maintaining all the things, like we should approach to the history. Like on the history, we should ask the person, his family members about the onset of disease, any trauma to his brain, any drug he is taking, or any family history of TB, or any infection, latest infection he have gone, or any history of seizure. Like all the things should be watched and carefully. And we should perform through thorough clinical examination. In thorough clinical examination, we should first maintain the vitals. Like we should measure the vitals like temperature, blood pressure, and we should look for respiration. In respiration, we should look for pattern of breathing. Like if the pattern of breathing is chain stroke breathing, then there may be lesion in the brain stem. And we should we should look for depth of consciousness. If there is any yawning, leaking movement of tongue, then it can means that the patient is not fully unconscious. We can look for involuntary movement. We can also look for like pachyceous ecchymosis to find out the cause. And also all the things like rule out hair. We can rule out hair injury. We can rule out medical metabolic causes. We can rule out neurological examination by doing neurological examination. All the things can be done to rule out every causes. We can look for posture. There can be decorticating posture, decerebrating posture. Like in the investigation, we can for all the cause we can do blood examination, like routine blood examination. We can do urine test. We can do ABG analysis. We can culture blood, urine, CSF. We can look for CSF. We can do MRI. We can look for the causative organism like malaria parasite. Like in management, we should first we should life-saving measure, like we should maintain airway, breathing, and circulation. We should give him proper. If the patient is hypoglycemic, we should give him proper glucose. How we can maintain, how will you maintain comatose person? We should maintain his posture, airway. We should give proper nutrition, and we should treat we should properly care bowel and bladder by catheterization. We should give skin care. We should to prevent the bed sore. Like we should treat the underlying cause, like main cause of coma. Like if there is meningitis, we should give appropriate antibiotic. If there is stroke, we can give thrombolytic. If there is metabolic change, we can treat the metabolic change. If there is electrolytic imbalance, we can give the electrolyte which is which is not present. If there is hypoxia, we can give oxygen therapy. And also we should maintain the manage the complication. In management of complication, if there is respiratory difficulty, we should intubate the patient. If there is infection, we can give broad spectrum antibiotic. There can be rise ICP, which can be decreased by elevation of head and also mannitol and hyperventilation. We can also, for convulsion, we can give phenytoin. Like in the long term care, we should care the oral hygiene by proper brushing technique. We can give skin care by toning his, like maintaining his not maintaining the posture for so long time. We can and also eye care should be done, like washing the eye and irrigating it. We can also give the fluid. We should avoid the constipation on this patient. From by this we can this way we can approach to the comatose person. It may be child or adult. Thank you.